Remember, we've got a new special offer. If you subscribe to the Spectator magazine today, get 10 weeks of the Spectator in print and online for the price of one, with a free bottle of Pimms worth £25 thrown in there too. That's 10 weeks of the magazine delivered to your door and a bottle of Pimms, all for just £4.95. Hurry though, this offer ends on the so-called Freedom Day, 19th of July. If you want to take it up, go to spectator.co.uk/TV offer. So, we have a watered-down Freedom Day on the 19th. Does the data justify this? Joining me now is Professor Tim Spector, Principal Investigator on the Zoe app. Tim, thanks for joining me. To start, there were more than 42,000 COVID cases reported on Wednesday, but the rate at which these cases are rising is trending downwards, and the number of people dying from the virus is far lower than what we were experiencing in previous waves. Are you convinced that the link between cases and severe illness from this virus has been sufficiently broken?
I believe the link has been not completely broken, but virtually broken, so that the rise in cases is no longer seen in deaths and hospitalizations. And I think we're moving into a new era in COVID in that regard. And I think we need to start looking at other parameters of the infection rather than this out-of-date look at deaths in particular, which isn't really helping us.
So you've talked about entering this new phase of the pandemic, and your focus is on new problems of cold symptoms and also long COVID. So what do you think we should be focusing on now?
I think we need to realize that we're still going to get large numbers of people infected. The data from the Zoe app today is actually showing that we're crossing over into having more people with infections having had a vaccine than unvaccinated for the first time. And so this is very much a new era in the disease, as in a way the unvaccinated population is slightly running out of susceptible people who haven't been infected. And they were mainly the younger ones. And we're getting back this larger group of people who've been vaccinated, of which a small proportion are getting a mild disease. And this means that the idea that vaccination is a complete cure, if you like, for the disease has to be reevaluated. Having said that, it's much milder, and we have the other problem of long COVID, and that is still in the unvaccinated. Quite a significant proportion of young people, about 1%, are getting debilitating symptoms at 3 months that prevent them going back to the normal function. And we're seeing about 500 to 700 estimated cases a day of that. And that should be the parameter that should be discussed by the media, not really deaths anymore.
Is the reason that you think we don't need to focus on the death metric as much now because you think that it's going to be one that stays low? You think that that aspect of the pandemic, sadly, the worst outcome, that you would die from this disease, is one that is now more or less under control?
I do believe that, yes. I think deaths are not going to go suddenly out of control. There might be some other deaths as we go into winter again, as we combine with flu, but I don't think this is going to be worse than a bad flu winter rather than anything else. So as long as we have a plan to keep booster vaccinations going in the very vulnerable, and that occurs well, and there's no major shifts in the variants, then I'm not really worried about deaths as the main outcome.
And you're talking about long COVID. It's a very frightening idea that one would be debilitated from having this virus for 10 days, 2 weeks, and then potentially have months, if not a lifetime of consequences of that. But one of the problems is we just still don't know a lot about long COVID, exactly how one goes about diagnosing it, what it means for somebody if they do receive that diagnosis. Is this because our priorities haven't been in the right place for some time and we haven't been putting enough emphasis on long COVID? Or is this just generally very difficult to go about diagnosing and finding out about viral fatigue that can come from all sorts of viruses?
I think it's a mixture of both. I think we've got to realise that with any new disease or new set of symptoms, it does take usually years to try sorting them out and working out which ones go with which type of disease, what the prognosis is. We really haven't got long-term data to help us. And also I think that most governments around the world have been focused on deaths of their citizens as the main priority and keeping the hospitals going, rather than this longer term public health problem, which is what's going to be engaging people from now on. So I think it's a combination of that lack of priority, lack of setting up studies early on, and the actual inherent difficulties in studying something that, as you said, does occur with most viruses to some extent, that there is a residual tail, and this is no exception. And other than the fact that the symptoms are particularly striking and often very long lasting. So I think we do have a problem. We do need a lot more data on this. We're still very deprived of it, and we don't know all the effects of the immune boosters, vaccinations on long COVID. We still haven't done some crucial, obvious studies in long COVID. There should have now been a study of steroids or dexamethasone in this by now, and it's surprising that hasn't been done. And other methods haven't really been tried. So I think we're in a place now we have to recognise this is probably one of the major public health problems that is going to have an impact on the NHS, and we need to spend many more resources than we are putting into it at the moment.
Well, we already have 5 million people on waiting list. The new Health Secretary, Sajid Javid, thinks it could go up to 13 million in the coming months. So certainly something that could burden the health service further. If we take all of this into account, especially looking at what you call the new phase, taking into account long COVID as well, what do you make of the reopening that's been announced on the 19th of July? Are you broadly in favor of it, or do you think that it's too carefree?
I'm broadly in favour. I think there has to come a time when you realise you can't keep people locked up and you can't keep telling everyone what to do and constraining their liberties, and you have to balance the opening up with the benefits to the economy, which has major health impacts, and of course try and encourage people who have preventable diseases from not just staying at home with them, but actually coming up to hospitals and feeling they're safer to come out and get treated, because the collateral damage from people not getting cancer treatments or getting diagnosed are horrendous, really, because already we had one of the worst records in Europe for cancer, and this is just going to make it worse. So also realizing that with the phase of I think it signals definite change in the phase of the disease as we move to pandemic to endemic, and there'll still be lots of disease going around. We're never going to get zero COVID, and we are moving to milder disease as long as people get vaccinated. So I think that's an important message, that these lifting of restrictions, which have been gradual, people seem to think it's all happening on one day, but it's not really. The Google mobility data show that people are back at about 85% of normal anyway already now. So it's not like it's going from 0 to 100%. And I think the only area I'm happy, and I was unhappy with, was that things like public transport and major crowding was not going to have any restrictions at all, and it looks like that is now wearing masks on crowded public transport, etc., is going to stay. And I think that is really important, just like you would you should do probably in any major flu epidemic, to try and control things. So doing things that don't harm the economy, that make general sense, keeping those going, I think is important. But we've got to start to work out how we're going to live with this virus, not keep running away from it.
Well, that was going to be my last question to you, Tim. Do you think, despite their willingness to move forward with reopening, it's been confusing messaging from government? That on the one hand, they're promising Freedom Day, but at the same time, they were indicating to people that perhaps they shouldn't use all of those freedoms and they should still voluntarily take many precautions or avoid crowded spaces. Do you think the messaging has been clear enough?
I wouldn't have used the same messaging the government has, and I think people are confused, and it will be that some people will still be very frightened to leave the house, and others will think that they can do whatever they like. And I think this is the potential danger. So I would like to see better messaging that this virus is going to be with us for years, that we should be looking for cold-like symptoms because we're infecting each other, because the government is still not putting itself on the line and saying actually things have changed, and that the 5 common symptoms are just like having a bad cold: headache, sore throat, runny nose, sneeze. These are really important to get that message across, as well as saying in a crowded place, if you're feeling unwell, the same precautions should carry on, but let's try and get back to normal. And I think they need to realise that people need the education. You can't treat them like sheep all the time. And I think giving them the latest information, that's what we've been trying to do with the Zoe app all the time. And I think that would be my message to the government, is to give people the facts, tell them what the symptoms are, tell them what their actual risks are, and let them get back to normal, and let people make their own decisions to some extent, but they should be safe to go on public transport, for example.
Tim, thanks for joining me.